penisin polysulfate, again, is really helpful, not just for degenerative joints, but for degenerative disc disease. Glutathione is one of our most abundant antioxidants. Better brain volume in people who have higher IGFs, better muscle volume in people who have higher IGFs, better recovery. Semaglutide, amazing drug or peptide for weight loss, for brain function, for heart function, for liver function. Any suggestions for chronic TMJ, so temporal mandibular?
Welcome to our Q&A highlights. Q&A sessions are recorded every month, and our enhanced members get an exclusive opportunity to ask questions from one of cellular medicine's brightest minds, Dr. Elizabeth Yurth. Get a chance to ask your questions by becoming our enhanced member at bli.academy/memberships. You also get access to our content library full of tips, articles, videos, lectures, previous live Q&A sessions, and more.
Any suggestions for treating back pain for arthritic backs? You know, it's so funny because spine pain, we always think of as differently from joint pain, and really they're the same disease. The facet joints in the back are just like a little mini knee joint. They've got a little tiny meniscus in them. They look just like a little mini knee joint. And the same pathology that's creating arthritis in your knee is creating arthritis in your back and in your disc. So a study came out pretty recently looking at degenerative disc disease, definitely is an inflammatory process. So if you took a mouse and you put a little tiny hole in their disc and you just then upregulated inflammation in them, within days, the disc was completely degenerative. If you blocked all the inflammatory cytokines, they healed the disc and they did fine. We're doing damage to our disc all the time. We're sitting too long, we're bending, we're twisting, we're lifting heavy things. We should be able to repair that. If we can't, it's because something's wrong with the inflammatory process. So really nice studies actually showing penisin polysulfate, again, is really helpful, not just for degenerative joints, but for degenerative disc disease, degenerative spine disease. And when they took rabbits and they used penisin polysulfate who had degenerative discs, they could actually reverse the degenerative disc. Can we do that in humans? Don't know, but we know we can probably stop the progression of it. In rabbits, they can actually reverse it. The degenerative discs became normal, and that's because the penisin blocked the bad enzymes that were destroying the disc. It brought vascular flow back to the disc that they needed. It blocked the inflammatory cytokines like interleukin-1 beta. So you have to remember this is an inflammatory disease process. So we block the inflammatory process first, and then if we need to go do some regenerative procedures, we do that. We also lots of times will use alpha-2 macroglobulin. It binds the bad proteins and the bad enzymes, and we'll put that in the disc and in the facet joints to kind of stop the degradative process and allow the body to heal and recover. So it's a nice alternative to steroids, because steroids, yes, they block inflammation, but they also block everything you need to heal. So you see more progressive degeneration after the steroids. With alpha-2 macroglobulin, you block the bad stuff, you allow the good stuff to bring back. Glutathione is one of our most abundant antioxidants. It's a peptide, it's a tripeptide. It's got 3 amino acids in it. Has huge important roles. It protects DNA, it contributes to protein synthesis, immune response, it protects us against Alzheimer's, Parkinson's, liver diseases, pretty much every age-related disease. It's really synthesized from amino acids. So when we eat protein in our diet, hence if you're very protein deficient, you're going to have less glutathione. The deficiency in protein in a lot of people as they're aging is huge. I see it all the time. And that's such a key thing for health, because muscle is going to be affected. Glutathione levels are going to be affected if your protein levels are low. Sirolimus, that's rapamycin. That was one of our longevity drugs. Or alpha-ketoglutarate, causing weight gain or increase in appetite. Sirolimus, definitely not. Generic rapamycin should have no reason. Alpha-ketoglutarate, interestingly, we actually use in some of our weight loss protocols. So you can use alpha-ketoglutarate for weight loss, but in some people, they do describe as stimulating appetite a little bit. So what I tell people is it's best done, sort of earlier in the day, potentially, and I'll have people do it before exercise. And usually I'll do like 3 grams twice a day and not take it too late in the evening. I don't see that much stimulate appetite, but there are some reported cases of that. Alpha-ketoglutarate a pretty cool thing, guys. For those of you who aren't familiar with alpha-ketoglutarate, it's needed for the reactions that produce energy for the body. So it's really a source for your amino acids like glutamate and glutamine. Remember, glutamate's your main neurotransmitter for your brain, so we can get better brain function with alpha-ketoglutarate. It's been utilized, for fat loss because of its improvement in energy production. It's involved in a lot of chemical reactions in the body. It regulates synthesis of collagen. It helps increase IGF levels. So it is something that's, I think, a very useful supplement. And again, for fat loss, there's been some studies on like a 3-gram dose twice a day, definitely helping with fat loss and building lean muscle. So it's a good supplement to keep in your mind. Can you say a little bit about tirzepatide and how it compares to semaglutide? Semaglutide, amazing drug or peptide for weight loss, for brain function, for heart function, for liver function, for not aging. It's both semaglutide and tirzepatide are what we call GLP-1 agonists. So that's the similarity they share. So they have very, very similar mechanisms in that perspective. Tirzepatide, which is under the trade name Mounjaro, as it's used for type 2 diabetes, is what's called a twincretin or a dual incretin receptor agonist. So it basically is working on two hunger hormone receptors, a GIP and a GLP. And when they looked at studies comparing tirzepatide and semaglutide, when you dosed semaglutide at around 2 milligrams and tirzepatide around 5, which is usually our starting dose, the weight loss was about the same. But when you got tirzepatide up to like 10 or 15, it was dramatically better. In fact, it rivaled bariatric surgery for weight loss. So tirzepatide at a 10 or 15 milligram dose is dramatic for fat loss. It gets expensive. So when you start dosing it that high, it gets pretty pricey. Any suggestions for chronic TMJ, so temporal mandibular joint pain? So number one, Botox can be very highly effective. Botox treatments significantly decrease pain, increase ability to chew for about 12 weeks. And that's the length of time the Botox is usually working. For about 3 months after injection. You can repeat it. It's very safe to repeat Botox every 3 months. And 90% of people had improvement using Botox. And it does so by blocking calcitonin gene-related peptide. We know that calcitonin gene-related peptides, CGRPs, are upregulated in a lot of disease states. Migraines, for one, TMJ pain, even arthritis. So blocking CGRP for people with TMJ can have very, very dramatic improvements in quality of life and a lot of other pain syndromes. So you can use, similar to what you're doing with migraine headaches, you can use something like Nurtec every other day, which is a CGRP inhibitor for migraines. You can use that every other day, and people had significant improvement in TMJ pain. When is the best time to take niacin? Baby aspirins, niacin, most of the cardiac protective things are better taken at night. Lots of studies to support this for baby aspirin. Has very different effects. These are circadian drugs, very different effects. What we really like is a new drug supplement that our friend, who's a pharmacist extraordinaire, Leonard, developed. It's actually a combination of low-dose leucine and citronelle and low-dose niacin, like 75 milligrams of niacin, very, very low dose. You don't need these super high doses of niacin when you mix it with these other two drugs to get the same effect. That taken at night had very, very, very dramatic effects on lipid profiles. And we think even on things like Lp(a). So we call this leucine SNA. So IGF, insulin-like growth factor. Remember, growth hormone, pituitary secretes growth hormone, tells our liver to produce IGF. There's IGF receptors on almost every cell in the body, including your immune cells. If you have low IGF, you're going to have lower bone density. Better brain volume in people who have higher IGFs. Better muscle volume on people who have higher IGFs. Better recovery. But we do know that IGF has some negatives, right? That we know that it increases reactive oxygen species. It reduces autophagy. So there's a balance. What is the right level? And, when you look at the research and it's a little bit scant, it looks like probably running the IGF levels right around 160-ish, 170 as you get a little older, probably higher when you're younger, is probably the best for all-cause mortalities to be somewhere in that range. As you get down to where you are, 105, you're losing bone, you're losing muscle, you're losing brain tissue. So most of us, as we get older, and some as we're younger, need something to improve growth hormone. And the safest way to do that is growth hormone secretagogue, like CJC and ipamorelin. And what we do with CJ ipamorelin is either dose it at 5 out of 7 days of the week, or you can cycle on and off it, 3 months on, a few months off, 3 months on, a few months off.